So my introduction, my name is Emily Taylor. I am an intern for the Moffitt Health Center right on campus, which is the health center on campus, in case you guys weren't familiar. I work with the health educators in the health center for my internship. I am in my last semester of school. I am a public health student. I started in nursing, but I am graduating with my public health degree in May 13th, we're ready. My focus is health education. And that's how I was able to get the internship, because for our practicum for public health, we have to do an internship in our last semester. So this is my internship. So today I'm going to be speaking to you guys about depression and stress and how it affects your general health, because I heard that your book of the month is about depression. I am 23. I'm not afraid to say my age. It's perfectly fine. But because I know some people can be testy about their age, but I'm not. That's why I'm talking so casual to you guys, because I am one of you. You're one of me. We're all college students. I want this to be an open discussion. I want this to be an open discussion. Ask me any questions. I am an open book. I have no filter. So there was going to be a presentation, but due to technical difficulties, there will not be. So I will be using my phone. So the first thing I want to do is go over just a couple contents in this bag. We're not going to get to the jar or the balloon and stuff until later, but I just wanted to go ahead and get these resources out of the way. So there is a student counseling services paper. I'm pretty sure you guys are associated with the student counseling services, but this is just in here just in case. This is a generic pack that we give to people, so you will see, there's some stuff about condoms and HIV and AIDS and PrEP and all that stuff. Good information. I totally suggest you reading it, but that's not the main focus of today. Student counseling services. There is the behavioral health clinic information in there for your purposes if you need it. And then there's a helpline card for domestic abuse in case any of you need one. Hopefully not, but in case you do or know someone who does, there's this helpline. And then today we're going to be using this Stress Lesson 2021 card. It's in there. You can use it at any time you want to. It's just what I'm going to be showing you guys today. This is just the videos from them, so you can do it at home if you want to do it with other people. If anyone needs the suicide hotline number, I also have that. I can just shout it out, or if you personally want to come up to me, again, I don't know your names. This is all anonymous, so you can come talk to me and I can give it to you personally if you know someone or needed it yourself. Okay, so let's just go ahead and get started. We're just gonna go through the pre-test. Is basically just a guide for me, so we know what our talking points are today. Because it's a conversation just between fellow college students. Okay, so the first question was, what is your definition of depression? Does anyone want to give their answer, what they wrote down? Yes.
I won't be in psychology because I'm a psych major, but it's a mood disorder that consists of feelings of hopelessness, emptiness, feeling basically worthless, and overall feeling of numbness.
Wow, that's actually really good. That's really close to the actual
I'm
definition.
a psych major.
I was like, that's really good. That's really good. Does anyone else have their own definition of depression that they would want to share? We can have one more person share. I won't require everyone to share. No. Yeah. Go ahead.
It could be an outlook of sadness. Really, Cameron, you really hit the nail on the head. I probably can't think of a better definition than
I know. You really did well.
Yeah.
It's okay. Okay, first I wanna make sure I get your pronouns right. What are your pronouns? Because if I have to reference you, what are your pronouns?
He, him.
I use they, them.
They, them?
She, they.
He, him.
Do you have a preference between she or they? Okay, and then they then. Okay, perfect. I just want to be very inclusive. I'm a very open person. I accept everyone.
Thanks for asking.
Yes.
What are your pronouns?
My pronouns? Thank you for asking. I am a she, her. She, her, hers. Yeah.
Okay.
No one else asks me. I always have to ask people, and everyone's like, weird. I'm like, it's 2022. Get it together, people. So I'm sorry. Okay, perfect. That was actually a very close definition. I'll just have like the official definition on here, but that was, yeah, psych major. You're gonna have like this entire presentation plan already memorized before I even tell you.
He's really smart.
We love that. Okay, so depression. Depression is also known as a major depressive disorder. It can be called clinical depression as well. It's a common and serious medical illness. It does negatively affect how you feel. It produces negative emotions versus the ones that you tend to associate with more positive emotions, such as like happiness and then like joy. I know those are synonyms, but they can be considered two different words or feelings. But yeah, so these are tend to be the more negative emotions, such as sadness, the feeling of worthlessness, like he said. But good news is it's treatable, so that's okay. But yeah, it negatively affects how you feel and the way you think and how you act. It is treatable. So even if I'm gonna use you, not to target you guys, but just like in the general you sense. For just how I speak. So if you are feeling those feelings of hopelessness, worthlessness, or like prolonged sadness, there are treatment methods for you. So I just wanted to go ahead and get that out there. Okay, so we'll go ahead and go over some signs and symptoms. So typically these signs and symptoms have to go on for 2 weeks consistently, not in just like periods, but like it has to be 2 weeks constantly, consistently, for you to be able to be diagnosed as depressed. So does anyone, I know this wasn't a question, but I know it kind of went to the definition that you stated, but does anyone have like their own like signs and symptoms that they know for sure would be associated with depression? It could be literally anything. Yes.
I know, like loss of enjoyment in things that you typically enjoy. So if there's like something that's just always a part of your routine, and then you just have no motivation or desire to do those things that you like doing.
Yes, 100%. That is a huge sign and symptom of having depression. A lot of people who have depression report that they can't get out of bed because it's too hard for them to get out of bed, because they just feel like they can't. They feel that they can't even brush their teeth because they can't get up and find that energy to go brush their teeth. If like something they enjoy, something like if they go play basketball every day, I don't, but some people find that enjoyable. But they go play basketball every day, and then all of a sudden they're like, I can't. I physically cannot get out of bed to go do this because I do not feel up to it. My body is like, no, I feel hopeless, I feel sad. Also, I don't know if you've ever had counseling, but like I had to do it for like extra credit. As far as I know, I don't think psychiatrists can actually say that you're depressed. I think they have to say you feel, because I went in there and they were like, you feel extra sad today. I was like, I feel depressed, but okay. Fun fact, that was completely random, but I'll just use random stories every now and then for that. So symptoms, they can be mild to severe. They can include feeling sad or having a depressed mood, loss of interest or pleasure in activities, like you said, changes in appetite, weight loss or gain unrelated to dieting, trouble sleeping or sleeping too much, loss of energy, increase of purpose physical act. So like you're unable to sit still, pacing or hand wringing, like dizziness, or like slow movements, like you physically just slow down and like everything takes like an extra second to process and for you to be able to say it. And then the feeling of worthlessness, and then guilty or difficulty thinking, concentrating, or making decisions. And then also to the severe signs and symptoms is the thoughts of death or suicide. Hopefully we get to treatment before some of these more severe symptoms occur, but they sometimes it's not able to do that. But the more severe ones I would consider to be the thoughts of death or suicide, and then everything else is like just leading up to that, in my opinion. But yeah, 2 weeks has to last the entire time, and then you can be like, then the doctor can be like, you have depression, major depression disorder, or clinical depression. It happens in 1 to 15 adults. It is more common than people think. People think of like, oh, depression. It's a thing people have, but it's not common. Like, I don't have it in my family. Typically, a person will have it. At least one person in their family will have it. Or, unlucky enough, the entire family has it. That'd be wild. But hopefully that doesn't happen. Okay, so what do you guys? Question number 2. What do you believe contributes to depression? Yes.
Well, there are both internal and external factors that can contribute to it.
Mm-hmm.
And some of them can include of course, biological imbalance. If your brain's not producing enough, serotonin.
Mm-hmm.
And then there's others like stress, trauma. If you suffer childhood abuse or domestic abuse, and just other external life circumstances and situations.
Yes, 100%. I feel like I really can't ask anybody else, because you always hit it like right on the head, the nail on the head, or whatever it is. Or head on the nail.
Yeah, I did better about the answer.
Like, man, shoot. I wish I was you when I was taking my own psychology course on these things.
Mm-hmm.
Like, I know this stuff, but like at the same time, before I learned this, again, I am not majoring in mental disorders, so this is like the information that I've been taught. This is the information that I've been taught to teach. So there's a great plethora, what a great word, plethora of other resources and information out there. I'm just giving you guys a summary, basically. So like you said, it could be internal, it could be external. There are behavioral causes, there's lifestyle causes, there's environmental causes, and then of course genetics and biochemistry. So some risk factors for depression is biochemistry. The different chemicals in your brain don't match up, and so then it causes symptoms of depression. So like you don't get enough serotonin in the brain. It can be genetical, like you could have it passed down between family member and family member. So if your mom has it, there's a great possibility that you might end up having. Well, even if it's just another mental disorder, you still have a greater possibility of getting depression or any other kind of mental disorder. And then like feelings of worthlessness and self-loathing are more common in major depressive disorder than in grief. And then in grief typically is caused by a major life event that revolves around something that's more saddening, such as the death of a loved one, death of a pet. That can also be considered a loved one, but like failing out of school, failing out nursing school. For me, that was a huge grief moment. And then just anything that's like can be considered very traumatizing to you can end up in grief, and that and then the suicidal thoughts that you get in grief and major depressive disorder, both are very important and need to be taken seriously, 100%. But the feelings of grief and suicidal thoughts is typically more associated with I want to commit suicide just so I can join my loved one, versus in depression it's more along the lines of I want to commit suicide because I feel that I am not worthy of living anymore. There's no reason for me to live. So grief and depression do go hand in hand, but there's also differences keep in mind, and I just wanted to make that clear as well. Okay, so number 3, does depression contribute to your overall health? Yes, no,
Yes.
maybe, no idea. Okay, perfect, yes, okay, good. I'm glad that we were able to collectively agree on that. Yes, it does contribute to your overall health. Because with the feeling of worthlessness and the feeling of low self-esteem and just overall not having the energy to get out of bed, that can cause some major, oh, there's a human. Hi.
Hi.
I'll get you a goodie bag in a second.
Okay.
Yes. I'm Emily. I am the speaker for today.
Nice to meet you.
Nice to meet you.
Sorry, late.
No, you're perfectly fine. You're good. Yeah, so not getting out of bed and stuff like that can negatively affect your health because you're not being able to take care of yourself. You're not able to get out of bed to get the exercise. You're not able to eat, so you can get the nutrients that you need. It negatively affects your overall health. And then we're gonna go over treatments now. I'm so sorry. I had all of this on PowerPoint, and so not having the PowerPoint is like throwing me off. I'm so sorry. It's okay. Depression issue. This is the one's in question, but does anyone have like a general idea of like how we can treat depression? Anyone at all? Yes. You're good. You're good.
So there's 2 pathways to treat depression. There's through medication, through Prozac and other antidepressants, and of course there's also talk therapy, cases such as cognitive behavioral therapy, and I think dialectical behavioral therapy also works. And just there's different types of therapy, and the preferred gold standard for treating is a combination of medication with therapy, especially if the person does have a chemical imbalance.
I really feel like you're the one who needs to be teaching this lesson right now because, yes. So everything I was gonna say is actually exactly what he said. So medication is very important. It helps with the brain chemistry. It helps raise serotonin levels, which raises the feelings of more joyful, positive emotions versus the negative ones. They're not sedatives or tranquilizers. They're not habit forming. They're just helping modify one's brain chemistry. That's simply it. Yes, psychotherapy or talk therapy, such as cognitive behavioral therapy. Cognitive behavioral therapy is therapy focused on problem solving in the present, and it helps the person recognize distorted or negative thinking with the goal of changing thoughts and behaviors to respond to challenges in a more positive manner, which is goes along with talk therapy. It's just like this is the typical treatment that people think of whenever you have depression. You just need to talk about it. You go to a psychiatrist, psychologist, or a counselor, and you just go talk to them, and they let your feelings out, and then they talk back to you, give you some positive things that you could be doing to help with these thoughts that you have on this time. One thing that you actually didn't say, that it's not used very much anymore, but still being used, is electroconvulsive therapy. It's mostly common for patients with severe or major depression that have not been responding to medication or talk therapy. It's been used since the 1940s, and back then it was like Frankenstein stuff. But now it's not like Frankenstein, where people are just being electrocuted. Now there's a lot more policies in place for the safety of the patients, and it's not as severe as it was. But there's major improvements, and the effectiveness is as mainstream rather than a last resort treatment. And then self-help and coping also helps with depression. We're gonna go over some things today. We're gonna do activities today that help with depression and stress overall. I don't want to take too much time. What time is it? Oh, it's 5:30. Okay. As I have my phone in front of me, it's okay. So the next thing we're going to talk about is stress. What is a way you help with your stress? Anyone? What do you do to relieve your own stress? Yes.
So I like going to the gym, just like working out from the stress out, hanging out with my friends, making art, and then also meditating. All of those things.
I love that. That's so fun. I don't agree with you on the gym part. That is not something that's stress relieving for me. That's stress inducing. But I'm glad that it helps you relieve your stress. Does anyone else want to share? Yeah.
I do a variety of things, but the one that helps the most is just listening to music. It, it just helps to, what I'm looking for, line up my mood and just try to get myself out of that, depressive cycle. And, I would say that that's one of the main things that helps with my depression.
Oh, nice. What kind of, everyone listen, music is a very big, helpful thing to help relieve stress and depression because it gets your mind off of what's going on at the moment. We will also be talking something that relates to that in a second. But what kind of music do you guys listen to?
Well, it's all across the genre spectrum, but mainly it's just, I listen to Pentatonics, Imagine Dragons, Fireboy.
Respect. I appreciate that. Does anyone else want to share some music taste that they have?
I listen to a lot of rock music.
Rap?
Rock.
Okay.
I mean, I do like rap. I listen to everything too, but
Yeah.
a lot of it is rock.
Like 80s rock or modern rock?
No, like modern and like funk.
Okay.
All the kinds of rock except for like hair metal. Shit.
I got your question. I listen to like Billie Eilish and
Me too.
like I hate to call them this, but like there's like sadness songs that you would listen to when they're sad because I like how slow and like impactful they are.
It's cathartic.
But yeah, so that's the kind of music I listen to. I was just curious, just a talking point. But these are all things that can help with stress. Everyone, I don't want to tell you one way to help stress because everyone has relieves their stress in their own way. There's not one way to relieve stress, like a collective way. Everyone is different. I promise it's okay. If your thing does not match another person, that's okay. It's targeted towards you. So hanging out with friends is a good example. This can help relieve stress. Listening to music. Honestly, just taking a nap can also help with relieve stress because it gets your mind off of things. It lets you just and it helps to relax your body too, which is a major stress. It can impact your stress if your body is not rested well enough. That was mostly, that was like the main thing about stress. But stress and depression go hand in hand most times, but it's not just stress and non-induces. Stress contributes to depression. Depression also contributes to stress. It's like they just go back and forth. They have like a two-way relationship. That's not the way I was supposed to describe it, but it's the way I am going to describe it. So if something stressful is happening in your life, something traumatic or something such as a loved one dying in your family, or you are failing a class, this stress from these events can cause you to can cause the symptoms of depression that could ultimately lead to a diagnosed major depressive disorder. Not prescription. It can be diagnosed. There we go. It can lead up to that. I forgot what I was gonna say. This is my first time ever teaching a health event before. Fun fact, I don't know if you've noticed, but it's okay. I just wanted to let you guys know, so I'm nervous, but it's okay. And that's why I keep pausing. But yeah, and then So that's like how stress can like affect depression, because it puts you, if you're super stressed, it's going to put you in these negative emotions, and if you stay in these negative emotions for a long time, it's going to contribute to a diagnosed case of depression. But depression also affects stress, because if you're depressed for a long time, then you're not going to feel up to doing anything. You're not going to have time, like you're mentally not going to be able to do assignments. You're not going to be able to go do things that you have to go do. And this is going to contribute to your stress, because now you're stressed because you haven't done any of this, because you've been in this depressive state so you haven't been able to do it. So it contributes to stress. So it goes hand in hand. And that's mostly what I wanted to say about stress, because they contribute to one another. Honestly, depression plus stress equals a bad idea, but we can't do anything. Sometimes we can't do anything about that. And then the last one I'm just gonna like talk about, and then I promise we're gonna get to our activity, is what do you think mindfulness is? Have we ever heard of mindfulness? You've heard of mindfulness? What is it? I want someone else to answer, because I feel like I know you've talked about this through psychology. Yeah. Does anyone else have a general idea of what mindfulness is?
Being intentional and aware of like your thought processes and being present.
Yes, perfect. That's where you, like you said, it's about how you are sitting down and you're working on something, and you start writing and you start working on it, and then you feel yourself drifting away, and then you're like, oh, I'm thinking about something else. That part where you realize that you're thinking about something else, that's mindfulness. And being able to draw your attention back to your assignment, that's also part of mindfulness. So being able to, it's kind of like, it goes hand in hand with the word focus, but mindfulness is more broad, and it's more of the active focusing kind of, where you just divert all your attention on one thing and realizing that all your attention is on this one thing and you're aware of what you're thinking. So we're gonna play mindfulness game. Yay. So there's not a lot of people, this is great. We're gonna play a game. And yes, these are play pinballs, but okay, everyone can stand. Our activity is gonna be, I want you to throw someone. Not throw it, just everyone has to be aware that they might. Does anyone have a fear of like have stuff thrown at you? No. Okay, my sister does, and I was like, I need to ask first. Okay, so we're gonna toss it, not throw. Toss it to someone, and so be aware if he's tossing it to you. Okay. Now I want you to toss it to someone else, not him, since he threw it to you. Okay. So toss it to someone else. Okay. So now you're gonna toss it to someone who hasn't tossed it or been tossed to. I'm the last person who hasn't been tossed to or has tossed. Okay, now who was the first person who threw it? So throw it to him. And we'll just alright, and then throw it to the person that you threw it to the first time. Perfect, and we're gonna go in that pattern. But you throw it to the person that you threw it to the last time, and then back and forth like that. So I'm just gonna hear it, and I just want you guys to like focus on just tossing this ball to each other. And then we'll get an balls as it gets better. Okay. So how do these like balls work? I was trying to make sure they were like heavy enough to not just float in the air. Okay. After this round, we're gonna add another ball. It's gonna be real fun. Okay. Okay, keep going.
I almost forgot.
Oh wow, this is wild. Good job, good job. Alright, perfect. Here's another one.
Sorry.
Okay, I have 100 of them, so it's okay.
I just couldn't catch it.
It's okay. I know that. You are all okay. Let's start again.
Oh my god.
Oh, we're doing big things, guys.
Yeah.
Wow, three. We're gonna see how big they are in one hand. We're doing big things. Okay, I'm gonna like get
Got butterfingers.
Oh, what's that
You're
name?
getting there second at some point.
Butterfingers is someone's nickname.
It's not Diary Monkey Kid. That's so random.
I know, I'm sorry.
It's not that,
I'm so
is
sorry.
it? I don't remember.
I'm actually not contributing to these exercises at all. This is I'm making it worse. It's okay. Okay. All right. Whenever you guys can stop.
It's okay.
All right. So what were you guys thinking? Without talking, not when I ask you questions. Well, what are you guys thinking about the whole time?
Probably looking at them.
You know, looking at them. Yeah. What were you thinking? Just looking at them.
Looking at them, focusing on the ball. Yeah.
What were you?
I was thinking, remember if it's directly before you, and then remember it's directly after you.
Perfect. What were you?
I was like, I'm gonna mess up, like I kept telling myself that.
Okay, we don't like pessimism, so
Yeah.
we love high self-esteem. So that's when you tell yourself, I can do this. That's honestly the moment it doesn't work out, but you still positive thoughts. We love the positive thoughts. Or you didn't know.
About trying not to drop the ball.
Perfect. Okay. Did any of you guys think about what we're having for dinner?
No.
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 What about the assignments you have to do after this?
No.
No.
Guess what that was? That's called mindfulness. You were focusing on the task at hand, and that's mindfulness. We were focused on what we were doing, and we weren't focused on anything else. We were not letting these intrusive, stressful thoughts come into us while we were actively trying to catch the ball and throw the ball and not drop the ball, even though we dropped the ball many times. That's okay. And so that is mindfulness. And so that's just like a little activity for you guys to be aware of what mindfulness is and to understand how mindfulness works. Does that make sense? Okay, perfect. Was this activity okay?
Yeah.
Okay, perfect.
Very clear.
Okay,
Yeah.
that we love that. Okay, now we can call it a table and go back to our seats. These little goodie bags are like kits that offered, like I said earlier, information about like STDs and HIV. HIV and AIDS is an STD, but like STD and sexual awareness, and then also counseling and behavioral awareness. Okay, so we have little activities inside these to help with stress, and that's for this like stress lesson 2021 papers. For if you scan the QR code, it's gonna fill up the video to make these, because you can make these outside here as well. We're not gonna be doing both of them because that will take up time, because the meeting does end at 6, but that's okay. So I did this earlier today, both of these earlier today, but this is a stress ball. We will pick out which one we wanna do. They both include water, so there's a sink, that's okay. So this one, I did a little different from the video, if you guys look at the video, but it is a stress ball. It is so cool. I did not know it was gonna turn into this after I made it, because there's little Orbeez in you guys' packs.
Oh, I love those.
That's what this is, Orbeez. I've never like used Orbeez before, so I didn't really understand how. I knew what they were, because you know all those commercials from like the early 2000s that are now coming back. Anyway, so these are little Orbeez and little packs for you guys. And the video will show you pouring it into a cup and then putting water on it and then putting it to the balloon. But what I did was put the Orbeez directly in here and put water in the balloon and tied it, and I was like, less mess. So, but I still got the Orbeez all over the desk when I made it, but it's okay. But it's like a handmade stress ball. I'll pass this around so you guys can feel it. It's so cool. While you're squeezing it, it takes your mind away from, it lets you focus on this instead of an intrusive thought. And then we have, that goes right there. And then we have this glitter jar. It's basically snow glue. So it has glue in the bottom of it, or glue in it, and then that's water, and there's just glitter. And it's basically snow glue. So you can watch like the sparkles go down and everything. You shake it up really hard, and then just kind of watch the sparkles just like settle at the bottom. Helps with mindfulness. Helps with mindfulness. It lets you focus on the glitter and go down, and it helps you like focus on something else other than what's at hand. So basically, these are two: stress relieving, a calming jar. That's its actual name. Calming jar and a stress ball. So these are two just basic things that you can like make really simple to help you focus on something else other than the stress or depressive thoughts that are at hand at that moment. So which ones do you guys want to make? You have this one or you have this one. This one doesn't work very well. Like I made it at like 11 a.m. and it just turned into this. So I suggest we do the jar. Yeah. It's just
And
like
also
more
in case
regular.
it's spilling.
Yes. Wow, look at that. There's still gonna be glitter, but I have paper that we can put it underneath. Okay, so, do we have access to this?
Yeah, we do.
Okay, perfect. Me and you are gonna tag team.
Yeah.
Everyone, let me see your jars. So we can go ahead and put the water in. Like, make sure you have enough glue to do that before and after.
Like everything?
Yep.
Okay,
Because once we want to create a water jet seal, so like the water doesn't leak out.
Where'd you get the top to like?
Just you can screw it like this. Right
Okay,
here.
just to get around the rim though first.
Yeah, what I did when I was doing it earlier, because I didn't realize how to do that until very end. What I did was I unscrewed it and then I just dipped it in there and did that.
That's smart.
Okay. And then after that, you can just pour the rest of the glue in there. Into the water, to the doors. After you glue the rim. And then that's when you can take off the glue.
And then put the rest of it.
Before
Yep, just pour it in. And it's satisfying. It just
Oh,
goes.
oh, this is nice.
I think part of the bottle went into your jar. Sorry, I just saw it happen and that's just how I noticed.
Thank you.
Mm-hmm. Yeah. The glue's
Oh,
just
it's very
changed.
sticky.
You guys are doing great. Is it? Okay, I'm gonna take a picture of you guys just so you guys are aware. Are you saving this video?
I'm sorry?
Are you saving this video in the teams?
Yeah.
Can you send me the link?
Oh, yeah.
Okay, perfect.
Yeah, we should definitely be able to do that.
Yeah, and then some glitter. You just put glitter in there on top. Speaking of green glitter,
This is so
that's
good.
actually not really green glitter. But do you guys know the McDonald's Shamrock Shake is back?
Really good.
It's like a minty shake.
Ooh.
Mm-hmm.
Do you like it?
I don't like mint, but I used to work at McDonald's, so that's how I know.
Yeah.
Yeah.
I like the cans mix their lemonade green.
I'm sorry.
Yeah, cans mix their lemonade green for St. Patrick's Day.
Oh, that's cool. And then before you put the lid on, we're just gonna give it a little shake. Just to like help the glitter go down like this. Just like swirl a little bit. Not much. It's gonna start going down, I promise. It should.
We're gonna win this is really sad.
This looks so cute.
And then whenever you're ready, you can put the lid on. Someone's about to pop off.
Yeah.
Oh, it's just leaking?
Oh,
Oh no, did it crack?
No, it was just really full. So I think the pressure of putting it on pushed some of the stuff out.
Love that.
Are there, are Are there napkins in the kitchen?
Yeah.
I like those colors. Here's the blue and the gold.
Blue is pretty.
Mhm.
Blue is so pretty.
The purple is magenta right there. Oh, gorgeous.
Yeah.
Mine's just green and silver, but I love green. So.
Yeah. There's also a bathroom back there as well. There might be towels there.
It's really just kind of like an igloo. Not glue. What's it called?
Snow globe.
Wow. It's not glue. It's two different things.
And like right now, like I'm having the glitter go down. I'm just literally touching the top. And this is really cool.
Yeah, no, it's really fun.
Oh yeah.
Of course you do.
It's probably a workout class. It's like F45 or something like that.
You can just put on your desk and then if you ever see it, you can just give it a little shake and be like, pretty colors.
This is making me wanna buy like a mini snow globe and keep it in my backpack.
Or you can just put that in your backpack if it doesn't leak anymore. But yes, they have I don't know where you find actual mini snow globes around here, but I know if you go to the bigger souvenir cities, they have those mini snow globes for $1.
Like the aquariums.
Or you can use a mason jar and make one.
Well, that's what I do.
Because you can, on a mason jar, you can take the lid, same concept with the glue and everything, but you take the lid and you can attach it, glue a mini figurine right here, and then flip it over, wait till it dries, and then flip it over, and then attach it, do the seal, and then you can shake it up and still in a mason jar.
That's so smart.
Okay. That's also another stress relieving activity to do.
You could put like a plastic dinosaur in there.
Yeah, 100%. Just have a dinosaur, some